Diabetic retinopathy is a huge market. If you all look around, you can see that there are more patients, more people suffering from obesity. And with obesity, that comes with a lot of complications. One of the key complications is diabetes. And with prolonged diabetes, it can damage the blood vessel in your eyes. And when that condition occurs, you have diabetic retinopathy. This is a huge market, mega blockbuster, multi-billion-dollar market. So as an investor, if you can find companies that develop a novel drug, novel solution for this highly prevalent condition, you can look at potentially banking big bucks or getting multiple returns for your investment. Welcome to our number 40th open mic webinar. The topic for this week that we'll be discussing is on diabetic retinopathy. For this week, the chairman of our Medical and Scientific Advisory Committee, Dr. Van Nguyen, will be presenting for us. Here, I'm going to give you a recap of what Dr. Van shared with our leadership team.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging Biotech Hedge Fund, Evergrow Healthcare Capital. We invest mainly in young growth biotech companies that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities. Within 6 months, we have an over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
First, Dr. Van went over the definition and the underlying pathophysiology or the science and medicine of diabetic retinopathy.
Thank you. Today we're going to talk about diabetic retinopathy, advance and innovation in biotechnology interventions. Diabetic retinopathy is a diabetic complication affecting the eyes by causing damage to the blood vessel of retina, leading to eventual blindness. And it developed in 81 who have diabetes type 1 to type 2 with progression is a chronic condition, and the risk increase with the duration of having diabetes and the control of diabetes. Thus, it's very important to control diabetes well to prevent this condition from progressing or even occurring. As you see, we have normal retina. The normal retina look very nice appearing when our optometrists or ophthalmologists examine our eyes, and that's what we're going to see on the left there. Whereas diabetic retinopathy result in conditions that display there. We have hemorrhages, we have aneurysm, we have cotton wool spots, we have hard exudates and soft exudates. So we can even see the blood vessel get die off and result in what we call infarction of the retina while in severe stages.
Shifting gear, Dr. Van then discussed the current or the prevalent treatment for diabetic retinopathy, and the mainstay of that is the anti-VEGF, a drug like Eylea.
Within the last 10 years, we have other development, including what we call antivascular endothelial growth factor treatment by injection. As you see here are the products of those type of treatment. Lucentis, Avastin, Eylea, and you see the manufacturer making those products as well. These products reduce the swelling and prevent new blood vessel, actually encourage new blood vessel, should be correct, is encourage new blood vessel formation.
Next part of the meeting, Dr. Van discussed the novel or the new approach toward treating diabetic retinopathy, and that's with gene therapy.
The new medical trends that we have, including, as we discussed in other topics, gene therapy, targeting genetic modification to hopefully cure diabetes. And then we have stem cell therapy, also hopefully replace the damaged retinal cells, but also hopefully repair the rest of the body cells as well. And of course, we have artificial intelligence, which allows to have early diagnosis and personalize our treatment plan.
Last part of the meeting, Dr. Van discussed about the potential company to invest in this niche. We have been mostly focusing on the pharmaceutical company that develop therapeutic to treat this condition or gene therapy, but there are other companies that makes eye drop that could also serve as a very lucrative investment opportunity.
As you know already, a lot of the eye drop medication, whether it's for diabetic retinopathy or macular edema or macular degeneration, all those eye drops are outrageously expensive in the United States. I can't speak for the overseas market, but I can hear from all my patients who are complaining they do not have the money to buy eye drops.
Is it just me, or does it seem like prescription eye drops are just crazy expensive?
Cystane eye drops, $1,919 per quart.
So their treatment has not been well managed because they're not giving the eye drop like they should. That's going to be the case. So I think that being a biotech hedge fund, I think we may want to look at that and see which company has the most profit in that type of realm, because I think that it's a very lucrative market regarding, when you look at the prices of the eye drops being given.
You want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us, we'll schedule a call to see if we are the right fit for each other.